Hello, ladies, you asked for it, and I'm here to give it to you, raw and uncut. So, today we are talking about abortions, or at a later term, miscarriage. So, but before we go to it, let me tell you about Ashakia Medical Solutions. Ashakia Medical Solutions is a company that give you solutions to your health or to your medical problems, starting from treatment to business consultation to beauty care. So at Beauty Garden, that's where all your consultation about beauty comes to be. And remember, there are other products you can use there for beauty, and they can give you complications or side effects. But remember, at Ashakia, when you go to their website or to their Facebook or Instagram page and you inbox them, they are able to, or even their YouTube page, they are able to give it to you the best way possible. So let's get back to the video about abortions. So what is abortion? Or what is a miscarriage? What do you understand? Maybe you can write down below in the comment section and tell us what you understand from the word abortion or miscarriage. Because as for us, medical health professional, we call it abortion, no matter if it's miscarriage, the one you call it miscarriage, or any other. Abortion is whereby you have conceived, and now because of different factors, the baby or the fetus has stopped growing or it has come out. So that is what we call abortion or miscarriage. So it can happen during the first trimester, and it has causes. So the reason we are here today, or I am here today telling you about abortions, is so that you can be able to protect ourselves, and so that we can learn on how to prevent ourselves from getting those abortions. So during the first trimester, you'll find that most are usually due to diseases whereby we can contact them through sex or through other ways. But sexually transmitted diseases can contribute, it's a contributory factor to abortion. So remember to be screened before you get pregnant. When you know that I'm about to get pregnant, get screened. And what do you screen for? You screen for something called torches. The torch screen contain a lot of diseases that can prevent first trimester during the first 3 to 4 months abortion. Okay, so in this case, when you come to the hospital, we are going to do a screen whereby we are going to look for if you have any STD, if you have any diseases like toxoplasmosis, all those we are going to check. And also we are going to screen your partner, because it's not just sexually transmitted diseases, don't just come. They are sexually transmitted. That's why it's also good to screen your partner, because you cannot be having, and maybe when your partner has it, and when you come into contact, you end up losing the baby or the fetus. So remember to get screened. Number 2, it's also good when you want to start conceiving, or when you want to start to conceive, you go to your doctor so that the doctor can determine the blood group of you both, okay, or your own blood group, your own genome or gene, so that you don't either carry a sickle cell, or maybe you are rhesus negative. You have heard about blood grouping and something we call rhesus. So that can also contribute to you getting the abortion. So it's good to be screened. Also, another thing that can cause abortion is anemia. Some of us, we say, hatutakunywa dawa. We are not going to take the prescriptions during the first trimester. We will go to the clinic later. You find that a mother is coming to you when they are already 6 months or 7 months pregnant. The effects are very bad. You can either get a miscarriage if you have anemia, or if you have other diseases that can contribute. So let's start the clinic early. We know that we want to conceive. Here I am. I have come to the doctor and I have been screened and the doctor has said we are good to go ahead and conceive, so that the miscarriage don't come, okay, or the abortions do not come. So it's good to get checked. Okay, right? Then during your time, your first trimester, second trimester, get to follow the clinics so that they are able to check, do you have high blood pressure? Do you have high sugars or diabetes? There's something we call gestational diabetes, something we call preeclampsia, which has resulted to a fetal death and also a maternal death. Yani a mama is dying and also the baby is dying inside the womb. So ensure that we get screened. Start your clinic early so that we can be able to check, okay? So that we can be able to get to know that this is what you have, this is how to prevent. Either we'll book you to a clinic, or we are going to tell you, these are the instructions to follow during your pregnancy, okay? And your partner can also be able to help you. Now, let's talk about other conditions that they are contributory factors, but like one, you have seen that maybe you're using a family planning and you got pregnant, and this is an unwanted pregnancy, and then you decide at home that because I don't want it, I'm either to go to a clinic and get a drug called misoprostol and do what? An abortion. It's very risky. Okay, that's why we are saying plan yourself. In our previous topic, we talked about family planning, and that family planning, when we were talking about it, we were talking about it so that we can be able to prevent unwanted pregnancy, so that we can also be able to prevent these abortions from happening. So remember to go to our previous video and check on which family planning will either suit you, okay, so that you don't get the unwanted pregnancy and do a botched abortion. Okay, we are calling them botched because most of the clinics are after money, and they will sell you that drug, or they will tell you, come, we do an evacuation, and they will do it. But what are the effects? Let's say you have done an abortion, and once you have done an abortion, there are products that remain. If those products of conception remain, if all of it is not evacuated, it can lead to something we call pelvic inflammatory disease, or worse, bleeding and death. So it's better to practice safe sex. That is one. Number two, we practice preventative measures like using family planning if we do not want. Number three, we make sure that if we are planning to conceive as a couple, we go to the doctor, get checked, so that we can be able to conceive the right way and to help us not to get abortions. Remember, there are also occupational hazard whereby I'm doing heavy lifting and my cervix is opening and the fetus is coming out, okay, because of the factors that are either from the uteral or from the cervical factor. There are also something we call fetal factor, yani the blood group of the baby is not aligning with your blood group, and so the fetus you get a miscarriage. Okay, so let us get checked. Remember to get checked. Number two, remember to practice safe sex and doing preventative measures like family planning, so that we are all able to come to one page. There are so many things we can prevent if screened properly. Okay, we can be able to prevent them. If we practice safe sex and you use family planning, we can also be able to prevent these abortions. So ensure that you follow us for more and more instructions. Okay, so until next time, when we will be talking about what happens later, what is pelvic inflammatory disease, that we keep talking, when we will be talking about the infertility issues, remember to follow us. All right, bye bye.